Hi, welcome to Grand Insights. I'm your host, John Feligno, founder of Grand Life Financial. And today I'd like to cover how you can prepare for healthcare costs in retirement and also what portion of that is Medicare going to cover. So, first place to start really is thinking about what the cost of healthcare is going to be, and budgeting for that is going to be largely dependent on your age and your overall health. So, it's going to be important to plan ahead because the cost of healthcare is going to likely increase as you age. According to the US Bureau of Labor Statistics, those that are 65 and older on average spend over $4,000 a month on medical expenses. So let's talk about Medicare for a second. So it's often misunderstood as a way to pay for all of your healthcare expenses in retirement. And original Medicare, which is comprised of Parts A and B, that can pay for some healthcare expenses. However, there are limitations. For example, it does not cover long-term care. So those are advanced care type facilities, skilled nursing care, and so forth. The other is dental and vision care. Those are not a part of original Medicare. So if those are things that you're interested in, Medicare Advantage is something that is offered through private insurers that are Medicare approved. And those plans generally cover the same costs that original Medicare does, but also Part D, which is the prescription drug coverage. And some plans can also extend coverage to include vision, dental, and hearing. Now, one of the strategies that I advocate strongly for with my clients is if they are still working and they're part of a high deductible health plan through employers, that they look at a health savings account. So this is again for people that are not yet enrolled in Medicare, but it's a great way to save money for your upcoming retirement healthcare costs. So the three things that I love about it from a tax benefit perspective are number one, the contributions are tax deductible. The second thing is that the growth, anything that you contribute to it over time, you're not paying any tax on that growth. And also, if you use those expenses for qualified medical expenses, those are paid for tax-free. So those three combined offer these triple tax benefits. HSA funds can also help pay for certain medical premiums, including Medicare and also perhaps even some long-term care insurance premiums as well. One of the things that I also recommend is that you wait and not use those HSA funds while you're still working, and instead allow those to accumulate and grow and maximize those every year as a family. And many plans offer an investment component that are built into it, like a 401k, 403b, or an IRA, and those will allow those assets to grow substantially so you can have a significant amount ready for yourself when you are going to retire. So if you have any questions, please email me, give me a call. You can also pose additional questions that you have for future topics. Thanks very much for joining.